Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. We are God's accomplishments, created in Jesus Christ to do good things. God planned for these good things to be the way that we live our lives. Ephesians 2. Welcome back to Policy and Rights here on Depictions Media Radio. I am Michael Clogs, your host for today, and as we've heard that many of the governments have provincial and federal governments have mandated that if you're a healthcare worker or an employee of the province or the federal government, that you must get vaccinated. This comes about because they're trying to introduce more confidence in government services and healthcare services, knowing that people will not get infected because the people helping them are vaccinated and are safe to be around, that they will not spread COVID-19 to those that they're actually helping. While there are some serious positives to the mandate, there are some possible drawbacks to it also, like anything else. Of course, knowing that the doctors, the nurses helping us in the hospital or helping our loved ones in long-term care facilities are vaccinated, knowing that they will not be able to spread the virus to our loved ones, is a very positive message. Knowing that you can go and get service by federal employees at, say, Service Canada or anything else that the federal government actually provides, or that again is a positive message. The same thing holds true for mandated provincial government employees in British Columbia, that they have definitely mandated that all healthcare workers must have be fully and completely vaccinated before returning to work. So, and in many private healthcare facilities, knowing that this is a positive step towards being able to help residents in their long-term care facilities, that they have already done so, and many are very much so in compliant of this. Here's where the drawback comes back. Yesterday, a question was asked of Dr. Bonnie Henry about in private sector employees being fired because they were not vaccinated. This might become a problem. That it's one thing that you are a government employee and therefore mandated in one direction to be vaccinated, but when a private sector does the same thing, it can become a rights violation. Now, along with this, when the question was asked of Dr. Bonnie Henry, Dr. Bonnie Henry said that it is a serious business decision to force your employees to be vaccinated. And now when you have a public official, a public health official, saying that it is a decision that you should be deciding to make your employees get vaccinated, we could have an infringement on our rights and freedoms as citizens of Canada. So there's nothing wrong with choosing to be vaccinated as a private citizen, and there's nothing wrong with deciding not to be vaccinated as a private citizen. That is how democracy is supposed to work. And being forced by a government or by an employer in a democratic society to do something is not necessarily the way to go about this. So let's listen to the British Columbia update on mandating long-term care and provincial employees to be vaccinated, as well as we have following that a update from the federal government with a lot of the same message. And let's listen to what they have to say about their mandates around vaccinations. Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. I'm honored to be here today on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. As all of you know, BC's vaccination campaign is going very well. One of the most impressive levels of vaccination in all of the world. 82.3% of those eligible, those over 12 as of today, have received their first dose of a COVID-19 vaccine, and 71.6% are fully vaccinated. The numbers of those partially vaccinated, of course, is declining significantly day and today, and the gap between first dose and second dose, those numbers, is declining significantly and will continue to decline significantly throughout the month of August. The priority that we've given and we give to long-term care and assisted living residences during this pandemic is significant, and certainly has been our top priority in terms of vaccination. We started vaccination in long-term care. It was the highest priority of all places in British Columbia in December of 2020, and have continued that effort of vaccination throughout our long-term care and assisted living homes since then. And the impact was immediate and dramatic. We went in a few short weeks from 49 care home outbreaks on January the 15th in British Columbia to almost none in the month of February, which shows the impact and the value of vaccination for those living in long-term care and for those working and helping people in long-term care. I want to recognize the exceptional work done in all our long-term care and assisted living homes by care staff, those who keep facilities clean, those who provide food, our nurses, people, doctors who work and support people in long-term care, health sciences professionals, pharmacists and others who do all of the work to support residents in long-term care. All those who work, especially in these difficult times when visitation has been limited in long-term care, to provide social and other supports for long-term care residents. People in British Columbia are grateful, and I am grateful for all the work that has been done. In terms of those working in long-term care in particular, we've given priority to those vaccinations, and you've seen those numbers across BC, more than 40,000 people working in long-term care. A very significant number as well in assisted living have been vaccinated since the beginning of the pandemic. A number of weeks ago, we announced new measures to ensure protection for those living in long-term care. Those measures included work on an order to ensure that we knew the vaccination status, public health knew the vaccination status of everyone working in long-term care by care home and by individual. And secondly, the intention to ensure that everyone who is not vaccinated be tested, that everyone who is not vaccinated have requirements for PPE that were more than those who were vaccinated. Of course, in this period, in this time, we're seeing additional cases of COVID-19 across BC, more than 500 yesterday, and cases in all regions of province. We've also seen some increase in the number of outbreaks. Those outbreaks are not qualitatively the same as they were in the months of January and February and December and November of last year. Nonetheless, they are disruptive. People in long-term care, living in long-term care in particular, are vulnerable, and especially vulnerable to COVID-19, as you know. And the fact of an outbreak, I can tell you as Minister of Health, but also as a family member, is incredibly disruptive and painful to residents in long-term care, to their families, and everyone else. It means limits on visitations and limits on life after a year of limits on visitations and on life, and on the fulfillment of life in long-term care. So today, Dr. Henry will be announcing some new orders to ensure the following: that everybody who works in long-term care and assisted living be vaccinated. This is a necessary step to take to protect residents and to protect staff in long-term care. We know, with variants of concern, that there is continuing risk for people living in long-term care, even vaccinated, and the risk of disruption continues to be high. And we think that this additional step to the significant steps we took earlier on, and we have announced our intention to take earlier on, that this additional step will add to the safety and the protection of all those working in long-term care. I want to thank everyone working in long-term care, and now I'm going to introduce Dr. Henry to go through the details of the provincial health orders. Dr. Henry.
Thank you very much, and good afternoon. We are here today, as mentioned, to announce important new public health measures for long-term care and seniors assisted living here in BC. As we have across the province, we've made excellent progress in our vaccination effort, and as mentioned, over 72% of people now are fully immunized. Particularly, this is important for people who are in those most vulnerable areas in long-term care and assisted living. And we, however, continue to see transmission, particularly amongst unvaccinated people and pockets where immunization rates are lower. This transmission is of particular concern in seniors and elders living settings. The risk is changing. As we have started to see an increase in much needed activities in our life, we have more people being able to come together, to go to work, to do all of those things that we've been missing in the last few months. And as well, we have the introduction of new variants into the province, including the Delta variant. And we've seen the impact of that in long-term care, where we now have 8 outbreaks introduced by unvaccinated people. And once we have recognized that once it gets into these highly risky settings, it can spread even to those who are immunized. And we've seen spread both to residents and staff, causing illness, but also disruption in the life of people in long-term care. Early in the pandemic, we recognized our seniors and elders living in long-term care and seniors assisted living were particularly vulnerable to severe illness and death from COVID-19. That's the setting where we have seen the majority of deaths, and severe restrictions needed to deal with outbreaks have affected their quality of life for far too long. That's why we took immediate actions last year to restrict movement of staff between long-term care and assisted living and assure access to PPE, and why we prioritized as the first part of our immunization program staff and workers and residents of long-term care. Today, we need to take an additional step to reduce transmission. We are announcing mandatory vaccination as a condition of employment for all workers in seniors in long-term care and seniors assisted living. This will apply to all licensed facilities, whether they are private, health authority owned and operated, or contracted facilities. The requirement will be made through a provincial health officer order that will have a number of things in place. Primarily, the new order will ensure that information on all workers in long-term care is provided to public health so that we can verify immunization status and have an understanding of the immunization status by facility of both residents and staff. That helps us in assessing risk and assessing outbreak potential in those facilities. In addition, we will have the implementation in the interim of the requirement for unvaccinated staff to wear masks and additional PPE, as well as being tested regularly. We will then be working with the individual staff, individual facilities to make sure that every person has access to vaccination and has their questions answered. And everybody, all workers in all facilities will need to be fully vaccinated by October 12th of this year. I recognize that this is a change from the direction that we announced earlier in the spring in June, where we thought it would be sufficient to have additional measures such as testing in place. We have now seen with the transmission of the new variants that we need extra protection in this highly risky situation. Even when resident immunization is high, as it is across the board in facilities in this province, we have seen transmission from unvaccinated staff, and it has reinforced the need for protection from all people in long-term care. So it is a change, but it is based on the situation that we find ourselves in now and how we need to deal with the data that we receive and take the necessary measures to make sure that we can get through this new transitional phase that we are in through the fall, when we also expect to see increased risks with other respiratory illnesses. This new order will also apply, the new PHO order will apply to volunteers and personal service workers who go into long-term care facilities. And it will apply immediately. We'll no longer allow anybody who's non-vaccinated, who's not fully vaccinated, to be a volunteer or to be a personal service provider in the long-term care assisted living facilities. We understand there are reasons why a small percentage of people may be unable to be vaccinated for medical reasons, and in those rare exceptions, public health will be working with those individuals, with the employers, and we will also be working through the next little while with unions and with owners and operators and public health to ensure that we have all of the provisions in place for people to make sure that we can get as high immunization rates as possible and support people through this process. I do also want to take a moment to thank each and every resident, care worker, nurse, healthcare practitioner, the people who provide the food services, the cleaners and workers in long-term care. We know this has been the most challenging time for all of you, and I know everybody has stepped up to do their part. And to the families who have entrusted these facilities to care for your loved ones, we know how challenging this has been for you as well. This is one additional measure which will ensure that we have the best protections possible to prevent outbreaks, to prevent the introduction of this virus into long-term care facilities and assisted living, and to make sure that we can return to the quality of life that our seniors and elders deserve. I will also take a moment to say that the reporting requirements for that are part of this order will apply to healthcare workers outside of long-term care and assisted living, so in acute care and community care. And we will be working with health authorities, with unions, and determining our path forward for all healthcare workers in British Columbia in the coming weeks. So I just want to say thank you, and we're happy to take your questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone line, please press *1 to enter the queue. You're limited to one question and one follow-up. First question today is from Penny Daplos, CTV.
Oh, hi there. Thanks very much for coming to me. Dr. Henry, jumping off from your comment there that you're going to be determining the path forward for all healthcare workers in the coming weeks, I had been planning to ask you what the vaccination rates are at Kelowna General Hospital, because the other day you said that surgical postponements were due to staff being impacted by COVID. But I've heard from several healthcare workers there in the meantime who tell me they've actually been short-staffed for months. It has nothing to do with COVID, and particularly when it comes to nurses, they're just really short-staffed. So are COVID infections and staff really impacting hospitals, or is it a matter of staffing issues that are having an impact right now?
It is all of the above. As we know, there's been a number of different issues in the interior in particular that have been affected by this. And yes, there have been staff impacts from COVID infections and from people who have been exposed. But there have been also staff shortages, as you know, for some time. And I know Minister Dix knows more about that.
I think it's fair to say that it's a challenging time in our healthcare system as well, though. I would say that we've, at Kelowna General Hospital, at Vernon Jubilee Hospital, Royal Inland Hospital, we've been doing more surgeries than we've done before, and we report on that regularly, and that reflects the extraordinary work of people there. So there are challenging staffing challenges in our healthcare system that are connected to, I think, in the last couple of months, especially extraordinary demand, ongoing challenges in staffing the system. And that's why we've made such, I think, exceptional investments by the standard of any province in our healthcare system. But nonetheless, those are challenges that exist. But when you have circumstances such as people off sick in terms of COVID-19, that has an impact as well. So all of those things are involved. There have been the cancellation of a small number of surgeries, I think 50 coming over the coming weeks, of the coming week, in terms of cancellations of surgeries at Kelowna General Hospital, and that reflects the adjustments that we make all the time based on the circumstances we see. In the terms of we are moving resources and moving staff, for example, into emergency rooms this week, as we announced yesterday, to support people in the heat wave, to support people related to smoke, and to deal with COVID-19. So there are challenges at Kelowna General, there are challenges in other healthcare facilities in the province for healthcare professionals and healthcare workers, and we're working through those, and COVID-19 simply adds to that.
Penny, do you have a follow-up?
I do, and I'm glad, Minister, that you brought up the surgical renewal, but I will leave this open to Dr. Henry if she wants to respond as well. It's anecdotal evidence at this point, but all signs point to a lot of nurses leaving the profession in significant numbers, in part because of burnout from the pandemic, but I'm also hearing again and again that unrealistic expectations for the surgical renewal are really, grinding people down, and a lot of nurses are generally feeling devalued, and this has really shattered morale for a lot of those who remain. So I want to know what you plan to do about this dual crisis of morale and staffing in healthcare.
I think this has been an extraordinary year in healthcare, and the surgical renewal plan, which has added resources and added nurses and added anesthesiologists and added those helping to book surgeries, has had a profound and positive effect. There's also and a positive effect across the system. The changes that have been made under the surgical renewal plan to address the fact that in March and in April and in May of 2020, we canceled non-urgent elective surgeries. We did indeed cancel some surgeries also in this in the past third wave of COVID-19. We addressed that by responding, as you'd expect the health system to respond, and I think we've done an exceptional job in doing that. And that job wasn't done by me; it was done by surgeons and nurses and healthcare workers and health sciences professionals across the system. It is, of course, a challenge to meet the surgical demands of a society that's both growing and the increasing demands of a society that to a degree is aging. But I think done an exceptional job. Look, before COVID-19, we went in terms of hip and knee replacements from 14,250 in 2016-17 to almost 19,000 in a short period of time. And that meant significant demands on the system, which we met with more resources in the system, but it also meant thousands of people getting their surgery sooner than they had done before. Similarly with MRIs, similarly with other types of surgeries. So the surgical renewal plan has been exceptional, and it's been delivered in an exceptional way by doctors and nurses and health sciences professionals. And of course, everyone working in the system in a pandemic, in the public health emergency that is the overdose crisis. And in this time and in the challenge for public health care in BC, this is a really difficult time for everybody, and we're doing everything we can to support people while delivering the services, especially the surgical services, that people in BC expect and deserve.
Thank you for bringing this up, Penny. I can't speak to the surgical services particularly, but I know from my personal experience in pandemics and in crises that we've seen, particularly ones that go on this long, it is not surprising to see people being burnt out. We all want this to be over. We all wanted this to be over last summer. And we have to deal with the reality that we are dealt with, and nurses have been on the front lines of this from the beginning. They've had to access PPE, they've had to change the way that we interact with patients, whether it's in a community setting, whether it's in a hospital. The pressure that we have had as healthcare workers through this pandemic has been over and above the pressures of trying to maintain families and relationships and all of the other things that we as a community are dealing with. So it does not surprise me that people are burning out, that they're leaving their profession. I see that from physicians. I see that from my ICU colleagues who are having challenges trying to find that balance again in our lives. I see it from public health physicians. I see it from all across the health sector. And we've also done the surveys, as you know, that help us understand the issues that we're dealing with in our communities and families across the country or across the province as well. So these are very challenging times. These are the things that we see after this type of an event that has happened and when it's gone on so long. So we do need to do what we can to support nurses, to support all of the healthcare workers in our settings across the province. And one of the really important ones was providing access as soon as we possibly could to healthcare workers to immunization so that we can support them taking that burden of fear and risk of COVID off as much as we possibly can. So we do need to support each other through this. It's unfortunate, I wanted it to be over too. I didn't want us to be in this position right now, but we are, and we need to keep going together. And part of that is making sure that we support each other to get immunized as quickly as possible, and especially as we go into the fall.
Burnaby Beacon.
For taking my question. Most prominent universities in Ontario have now made vaccinations mandatory. Are you recommending that universities here take their own steps in that regard if they see fit? Or do you think that they should be staying within the provincial guidance that you said last week that you're working to refine?
So I wouldn't say most universities in Ontario, at least not from what I've heard. However, we, as I mentioned yesterday and last week, these are questions that we are addressing with our provincial committee, working together with the post-secondary institutions in the province. They're very important questions. We have always had a collaborative approach. We have the basic guidance that we put out, and we are refining it as we learn more going through these last few months. These are active discussions right now. What is the role of masking? What is the role of immunization? And we'll have more to say about that next week.
Do you have a follow-up, Srishti?
Yes, please. The original guidance from July 5th for post-secondary schools predicted that cases would be declining by September. Was that projection premature? Did it not take into account the possibilities of variants?
Of course, it took into account everything that we knew at that time. We say that we're going to be continuously monitoring, changing, adapting as we learn more about this virus. And that's really what we are doing. That's one of the reasons why we've put in these measures today, which are also a change from what we thought would be the approach earlier on in June. So, these are, as I said, part of the constant connections and discussions, looking at the data, looking at the pros and cons of different approaches, and understanding the real situation that we're in right now. But I will say we are in a different place, and that is clear, and it remains clear. That we are no longer seeing the same types of impacts across society that we were seeing prior to having vaccination. So it is not the same questions that we're asking or answering right now. Immunization rates are high. We're seeing transmission in unvaccinated people primarily, overwhelmingly. 96% or 93% of our cases are people who are not fully immunized. So that's the difference that we're in right now. And yes, when we have a highly transmissible variant, it means that it can move quickly through unvaccinated or undervaccinated people. So the way we address that is not the same as where we were just a few months ago.
Minister Dix. So there are some businesses in BC who are laying out this policy that they would only hire employees who are vaccinated, and some of the businesses I have spoken to have gone to the extent of saying their present employees that they would be fired if they don't get vaccinated. Is this something that you encourage?
Yeah. So, our role is to look at health. But yes, these are the things that businesses need to make decisions based on the risk of their business and the risk to their business. As we just talked about, in some areas, if you have people who are coming in who are non-immunized and who cause an outbreak in that business, that can be very severely impact the ability of the business to function. And we've seen that, as I mentioned, in places like some of the restaurants, etc., in the central Okanagan. So these are business decisions that they need to make in conjunction with their own labor lawyer advisors. But I do think it is a perfectly valid thing. We also need to look at, how do we ensure that places like the arts, if we're having high-risk settings, and we're talking through this, what does it mean to have a high-risk setting right now with 80% of our population immunized, and reducing the risk for those people, with a small proportion of people who might bring risk into those settings. So those are all discussions we're having.
Do you have a follow-up, Jawad?
Yeah, thank you. So just to understand it better, even if businesses are non-essential, they are well within their right to impose such a rule on their current employees to be vaccinated to be able to work there.
Absolutely. Absolutely. I think that is a business decision. And I've had discussions as well with other groups like faith leaders and how to encourage only immunized people to attend services. Those are decisions that faith leaders, communities, church groups, choirs make for themselves, understanding their communal risk. They don't need an order for me to do that. Those are things that businesses, communities, groups can do together to collectively reduce their risk.
Next question is from Rob Monroe, Info News.
Thank you for this, Dr. Henry. I have been trying for quite some time to get vaccination rates for healthcare workers in general and in long-term care, and they haven't been able to provide them. You're bringing these measures in because of a need to get this vaccination done. Is there any data that you can provide of how many people, particularly in long-term care and acute care, that work there are vaccinated? And why can we not get that information?
So my understanding is that information has been provided from what we know. So what we know are general levels by health authority and by overall in the province. What we also know is that we don't have detailed information on every individual by facility, and that's what part of this order is. So this order will allow us to understand vaccination rates by facility for all workers and residents. And that is not information that we have right now because we don't have a requirement for people to report their immunization status to their employer in long-term care and assisted living. So the reason it's a provincial health officer order is so that it applies across the board to both private facilities, all licensed facilities essentially. So we will have that information, and as you say, it is important information for us to know in public health at a detailed level so that we understand risks by facility. So we do have aggregate information which we have shared, but we don't have that facility level information, and that's one of the things that we have been putting in place, the ability to collect that information, and over the next couple of weeks we will have that by facility across the province.
Follow-up, Rob?
Yes, and with slightly different angles is there have been some children hospitalized in Interior Health. I believe one was an 11-day-old baby, and I think you made a comment another has been. Can you provide any more details of those hospitalizations, how serious they were, and leads to the question of where are we in terms of possibly vaccinating children under 12? Where's the science on that?
Sure. So, yes, I was asked the question about whether there were children in ICU in the interior, and the answer is no. And there are no children under the age of 10 or 12 hospitalized across the province right now. There had been, over the past month, there have been 2 children under the age of 12 who've been hospitalized in the Interior Health region, and that's the amount of information. We don't provide identifying information about individuals, but both of those children have been discharged home, which is good news. But yes, it is a concern, of course. We're following the data quite closely around what's happening around immunization for younger children under the age of 12. So both Pfizer and Moderna have been doing what we call dosing studies, and they've come up with their dosing schedule. So it will be a lower dose for children 6 to 12 years of age, and a lower dose for 6 months to 6 years of age. So those are the 2 sort of age groups that we're looking at for children. Both Pfizer and Moderna have done those dosing studies, and they're now near the partway through their phase 3 studies, which is looking at non-inferiority and safety compared to the adult immunization. So what we do, we don't need to repeat all of the major randomized controlled trials anymore. What we need to do is show that there is the same immune response in younger people that provides protection for adults. So that's the type of studies that are going on right now. We understand from Pfizer that they're likely to have the information for at least 6 years to 12 years of age, so school-age kids, probably by the end of September into October. And then the National Advisory Committee and Health Canada will review those data to provide approval for use or licensing for use in Canada. We expect that it'll be submitted to Health Canada at the same time as they're submitting to the FDA and the European regulatory agencies. That's one of the things that this pandemic has done, has made all of the regulatory agencies to work together and to share information. So it is a potential that we'll have at least one vaccine available for people younger than 12, maybe by the end of this calendar year. If we're lucky, maybe into November. So that's what we're following. The things that Moderna is a little bit farther behind. It looks like it probably won't be until the early in the new year in 2022. But things can change, so we'll be watching that as well. One of the good things that we're hearing from Pfizer is that they have a new formulation for their childhood vaccines for the under 12, and that they might be fridge stable, which would be really great because that makes it much more flexible in being able to provide immunization.
We have time for one more question today. Emily Warren, CBC.
Yes, good afternoon. Thank you for the presser. Dr. Henry, there has been a dramatic increase in cases in the Kootenays, similar to the situation in central Okanagan. And we're wondering, will similar restrictions be extended to... Oh, sorry. In the past 2 weeks, never mind, I got the wrong question, my apologies. In the past 2 weeks, you've been making targeted restrictions and announcements for high-risk settings. Why aren't you telling British Columbians that widespread changes, for example, reinstating the indoor mask mandate, may be required? Why is a stronger touch not required for all of BC right now, given that the rolling averages of cases outside the interior have been quadrupling in the past 2 weeks?
Yeah, so those are things that we've looked at, and when we put out the Step 3 plan, we understood that that we're in a different place when we have most people protected through immunization. So it means that we're decoupling the hospitalization and deaths, particularly, from the cases themselves. So we are looking at a more regional or local approach, and my colleagues across the province in public health have been doing this. We've been monitoring and so it depends on a whole bunch of things. So I worked very closely with Dr. Sue Pollock in Interior Health when we started to see the impacts in the central Okanagan, not just on people getting mildly ill and having to stay home, but impacts on businesses and spillover into healthcare workers becoming ill, into long-term care homes, and into the hospital, as we talked about earlier. So there are a number of different factors that we look at to determine whether we need to take additional measures to address focal transmission, and it was really took off quite rapidly, as you will recall, in the central Okanagan. So yes, they're watching very closely in the Kootenays, and there was a couple of other places around the province where we've seen spikes of cases, but they're often related to a single event that we are able to identify many of the contacts and isolate them before there's transmission, before there's spillover into other more vulnerable areas. So I know Interior Health is working very hard in the Kootenays to try and contain what's happening there. We're also seeing very different types of patterns in different parts of the province. So right now, and we talk every day with my public health colleagues, right now we feel we don't need to take additional measures across the board for sure, or in specific areas, but we will if we need to. And there's been a couple of outbreaks very recently in Fraser Health, in long-term care, and so additional measures have been taken there. We are looking at this, and these are the things that change as we're moving through this period of time. But I will reiterate again that most of these cases, whether they're in Fraser Health, whether they're in Vancouver, whether they're in the interior or the north, are spread by people who have not yet been immunized. And so that's what we can all do to support people to get the vaccines that will keep us all safe.
Emily, do you have a follow-up?
Yes, thank you so much, Dr. Henry, for your answer. And I was hoping for both of these answers, if Minister Dix, if you could please as well get us an answer in French. But Dr. Henry, you did touch on this as well a bit earlier, that many sports and cultural event organizers are now considering asking for proof of vaccination for people to be able to attend them. How does this affect your views on mandatory vaccination for everyone? And if we could get that answer in French as well, that'd be great. Thanks.
So again, I think there is a really important ability for people to make that decision about their personal health. We know there's some people who are unable, though that's rare, have medical reasons not to be immunized, and we need to support them. But I also think we need to put it commensurate to risk. But we have said early on, and I still, now that we have enough vaccine available, so we have been on an evolution from this. It's not fair to put in restrictions on people when they don't yet have access to vaccine. We're in a place now, since about the end of June, in the last month or so, where we have adequate supplies of vaccine, we have adequate availability, and really it's about people, and I hear from people that we talk to that a lot of it is around convenience, but also around a bit of complacency. So we need to make the point to many people that now is the time to get immunized, because it is going to have an impact on your ability to do some of those things that you may want to do. And attending a sports game is a good example. Those are higher risk environments, indoors, going to a concert indoors. If you choose not to be immunized, then you don't necessarily have the right to go into a higher risk environment with a bunch of people who have been immunized and are protected. So those are decisions that we need to make personally and as a group here, and those are the discussions we're having with industries and others across the province.
Thank you for listening to Depictions Media Radio.
Merci beaucoup, Jean-Sébastien. Bon après-midi, tout le monde. Good afternoon. Today, I'm joined by my colleagues, the Minister of Transport, Omar Alghabra, and the Parliamentary Secretary to the Minister of Health, Jennifer O'Connell. Depuis le début de la pandémie, mon équipe ministérielle et moi travaillons en étroite collaboration avec eux et leurs équipes. En tant que membre du Conseil des ministres, je constate aussi régulièrement l'expertise et le dévouement des fonctionnaires fédéraux comme ceux que j'ai le plaisir de côtoyer quotidiennement. En cette période difficile et incertaine, ils se sont dépassés pour fournir des services critiques aux Canadiennes et aux Canadiens à une vitesse sans précédent. And as vaccines became readily available, public servants stepped up yet again with their arms out among the many Canadians who have already been fully vaccinated. That is so important because we continue to face more transmissible and more dangerous variants of concern. Les autorités de santé publique continuent de nous dire que les vaccins sont de loin le meilleur moyen de mettre fin à cette pandémie. Nous le savons. C'est pourquoi nous vous annonçons aujourd'hui que nous exigerons la vaccination dans la fonction publique fédérale. We know that vaccines are the best way to end this pandemic. That is why we are announcing today that we will require vaccinations in the federal public service. Et nous lançons un appel à toutes les industries sous réglementation fédérale et évidemment aux sociétés d'État et aux agences fédérales de faire de même immédiatement. Étant le plus important employeur au pays, le gouvernement du Canada veut faire de sa part pour protéger les fonctionnaires et leurs communautés où ils vivent et travaillent au Canada, et ça aussi partout dans le monde. Il s'agit aussi d'encourager fortement les autres en exerçant un leadership évident fédéral dans les secteurs que nous réglementons aussi. Tous ces efforts visent à aider le Canada à atteindre la couverture vaccinale dont nous avons besoin pour ouvrir l'économie, pour la garder ouverte et pour protéger les millions de personnes non vaccinées qui sont vulnérables aux infections. Nous nous concentrons sur la santé publique des Canadiens et sur le soutien de la résilience économique de notre pays. La prochaine étape consiste à mobiliser nos principaux intervenants, notamment évidemment les syndicats, les agents négociateurs, avec lesquels nous avons travaillé en étroite collaboration tout au long de la pandémie. Nous collaborons avec eux et d'autres partenaires de la famille fédérale pour mettre au point les détails de cette robuste approche fédérale en matière de vaccination. nous étudierons notamment comment cette exigence sera mise en œuvre au moyen d'une preuve de vaccination et par d'autres moyens de protection au besoin. We will take the time needed to get this right, but we will also act very quickly. The next step is obviously to engage our key stakeholders, including unions, bargaining agents, to build the details of this strong, mandatory federal vaccination plan. We are targeting implementation early this fall, and we will obviously communicate the details as this work unfolds, but this work begins immediately. The Government of Canada has a large workforce and a large reach to help in the fight against COVID-19. It is both our opportunity, but also our duty to lead by example. Nous avons le devoir d'assurer la sécurité de nos employés et de ceux qu'ils servent, ainsi que de leur communauté aussi. C'est ce que nous faisons avec l'annonce aujourd'hui. Je vous remercie, and now I'm happy to turn over the microphone to my friend and colleague, the Minister of Transport, Omar Alghabra. Omar.
Thank you very much, Dominic. Good afternoon, everyone. Good morning. Bonjour à tous. I would like to start by acknowledging that I'm speaking to you today from the traditional territory of the Mississaugas of the Credit First Nation. Canadians have demonstrated strength and resilience throughout the pandemic and have shown extraordinary commitment to following public health advice. Canada's vaccination rate is among the best in the world. But to protect ourselves and each other from the virus and its variants, we must do better. We need to reach as many Canadians as we possibly can. Today, we are announcing that the Government of Canada intends to require vaccinations across the federal public service. Following this example, we also expect that Crown corporations and other employers in the federally regulated sector will also require vaccination for their employees for the same compelling reasons. Furthermore, as soon as possible in the fall and no later than the end of October, the Government of Canada will require employees in the federally regulated air, rail, and marine transportation sectors to be vaccinated. In addition, the vaccination requirement will also extend to certain travelers. This includes all commercial air travelers, passengers on interprovincial trains, and passengers on large marine vessels with overnight accommodations, such as cruise ships. Of course, for those few who are unable to be vaccinated, accommodation or alternative measures, such as testing and screening, may be determined in each situation to protect broader public health by reducing the risk of COVID-19. I've heard from employers in the federal transportation sector who are concerned about protecting their employees. Workers are counting on their employers to develop robust vaccination policies for their workplaces. Vaccine requirements in the transportation sector will help protect the safety of employees, their families, passengers, their communities, and all Canadians. And more broadly, it will hasten Canada's recovery from the COVID-19 pandemic. We have seen how devastating COVID-19 has been to our transportation and tourism sectors. We must protect the hard-won gains made by Canadians. Canadians deserve to feel confident when traveling that the environment around them is safe. We need to regain public confidence in travel. Such confidence will give a boost to our industry. Being vaccinated makes the workplace and travel safer for everyone. We will work closely with key stakeholders, operators, and bargaining agent in particular to develop a practical approach to requiring vaccines in these sectors as quickly as possible. As I noted, the health and safety of Canadians will always be our first and most important priority. La santé et la sécurité des Canadiens sont notre priorité. And lastly, to my fellow Canadians, next time you get on a bus to go to work, hop on a ferry, take a train or fly to another Canadian city, or any number of other industries public service employees are part of, remember, they work hard to serve you every day. Let's protect ourselves and each other by getting vaccinated. I want to thank Canadians for their continued cooperation in the face of the global COVID-19 pandemic. Canadians want to get back to normal as quickly as possible. Those who get vaccinated will pose less risks to themselves and their fellow Canadians. Because of this, they will be able to benefit from additional easing of public health measures. To those who have not been vaccinated yet, know that vaccines are our best way out of this pandemic. Please go get your shot. We're not quite there yet, but by continuing to work together, we will end this fight. Thank you. Merci. And now I will ask my friend and colleague, Jennifer O'Connell, to take the mic.
Thank you, Omar and Dominic, and good afternoon, everyone. I'd like to start by thanking Canadians for their commitment to fighting COVID-19. We know vaccines are key to beating COVID-19. And while we still need to practice public health measures, particularly in crowded and indoor spaces, vaccines have allowed us to reconnect with loved ones and return to many of the activities missed during the pandemic. They are also essential to ensuring the safety of our employees. And this is why the federal government is committed to protecting the health and safety of all Canadians. Vaccine requirements across the public service reflect that commitment. Required vaccination also sets an example for everyone, including other public and private sector employers. This will help keep our country safe and contribute to stopping the spread of COVID-19 and its variants. As we face the fourth wave of this pandemic in Canada, it is more important than ever to bring down COVID-19 infection rates, and we have enough doses to fully vaccinate every eligible person in Canada, and it is important that everyone does their part to increase the vaccination uptake. So if you haven't been vaccinated yet, I urge you to make a plan to do so. Thank you so much, and I'll turn it back to Minister LeBlanc.
Jennifer, thank you very much. And Jean-Sébastien, over to you. We're obviously, all three of us, happy to take questions now. Jean-Sébastien, à vous.
Merci beaucoup, Monsieur le Ministre. Donc, tel que mentionné, nous allons maintenant débuter la période de questions. Ministers and the Parliamentary Secretary will now be happy to take your questions. As usual, it will be one question and one follow-up per reporter. Donc, comme d'habitude, ça va être une question et un suivi par journaliste. And I will now hand it over to the operator for the first question. Donc, je vais maintenant passer la parole à l'opérateur pour la première question.
Merci, thank you. Please press star 1 at this time to ask a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Nicole Thompson of the Canadian Press. Please go ahead. Your line is open.
Hi, thanks, ministers. I'm wondering what will happen to the federal employees who choose not to get vaccinated.
So it's Dominic LeBlanc. I'll be happy to offer some comments. And
in over 2 decades. That is an economic issue. Now, early learning and childcare has long been a feminist issue. Canadian feminists have been fighting for universal daycare for more than half a century, for more than 50 years. But COVID has revealed to all of us that it is also an urgent economic issue. In the April budget, our government committed up to $30 billion over 5 years, with $9.2 billion annually in permanent funding combined with previous investments to make the long-held dream of a Canada-wide early learning and childcare system a reality, finally. And we committed to build this system in partnership with provincial, territorial, and Indigenous partners. Early learning and childcare is really important to me as a working mother of 3. But it is also important to me as Deputy Prime Minister and critically as Finance Minister because it delivers a jobs and growth hat trick. It allows both mothers and fathers to work, increasing our labor force, and that will make our economy grow. And it makes life more affordable for those young families. It creates good, well-paid jobs for early learning educators who are mostly women. And let me just offer a shout out to the great early learning educators we see here in the corner working so hard. Thank you. They're doing the most important jobs anyone is doing in this room, and they need to be compensated accordingly. And a universal early learning and child care system across Canada is going to help us raise an outstanding generation of young Canadians, of children who get the best possible start in life. A child care centre is as important to our economy. It is as much a piece of critical infrastructure as a bridge or a road or a grain elevator. Today, I am so delighted to announce that our government has reached a landmark agreement with the province of Saskatchewan to deliver $10 a day early learning and childcare to Saskatchewan families with children under 6 by the end of 25-26. And families will see a 50% reduction in fees by the end of next year. This support will be available for children in regulated childcare, including home-based childcare. Our agreement also supports an early learning and childcare system that is fully inclusive of children with disabilities. Hope's Home is a prime example of that, and I am so astounded and impressed by the care you give to children with medical needs and to their families. These families know how important it is to be able to get access to affordable, high-quality care for their children. The Government of Canada will contribute close to $1.1 billion over 5 years to help the province of Saskatchewan deliver this essential support for children and families. The funding will also make childcare easier to find. Within 5 years, Saskatchewan will have 28,000 new regulated early learning and childcare spaces for children under 6. The federal funding will also support the educators who do incredible work to help our young children learn and grow. Aujourd'hui, j'ai le plaisir d'annoncer que notre gouvernement a conclu une entente historique avec le gouvernement de la Saskatchewan en vue d'ouvrir des services d'apprentissage et de garde des jeunes enfants à $10 par jour aux familles de la province ayant des enfants de 6 ans au moins d'ici la fin de l'année 2025-2026. De plus, les familles verront une réduction de 50% des frais d'ici la fin de l'année prochaine. Ce soutien sera offert aux enfants qui fréquentent des services de garde réglementés, y compris les services de garde en milieu familial. Le gouvernement du Canada versera 1,1 milliard de dollars sur 5 ans pour aider la Saskatchewan à offrir ce soutien historique aux enfants et aux familles. De plus, les familles auront une plus grande facilité à trouver des services de garde d'enfants. D'ici 5 ans, la Saskatchewan disposera de 28 000 nouvelles places en services d'apprentissage et de garde réglementés pour les enfants ayant 6 ans et moins. Le financement fédéral soutiendra également des éducateurs, éducatrices qui font un travail incroyable pour aider nos jeunes enfants à apprendre et à grandir. Our government is also committed to working collaboratively with Indigenous leaders to ensure that Indigenous children have access to culturally appropriate, affordable, and high-quality early learning and childcare. I made a personal commitment to Canadians on Budget Day that our government would get this done. And since April, we have been working really, really hard to do just that. I have to say that the remarkable speed and success with which we have been achieving early learning and childcare agreements across the country is really due to the hard work and the commitment of my friend and colleague, Ahmed Hussein. Thank you so much, Ahmed. This is really historic. And I do also really want to thank you, Dustin. I know that you and your team have worked really, really hard, really, really fast. I know that the two of you thought there were moments when you thought we wouldn't get there, but you did. And I want to thank all of the public servants from Saskatchewan and from the federal government who I know have been committed, probably your whole professional careers, to see this actually happen. And people really have been working weekends. They've been working long nights to actually achieve this deal. So thank you very, very much. I also have to say, I asked Ahmed if I could be here for this particular announcement because it's personally really important to me. I am a Ukrainian Canadian, daughter of a prairie farm in Peace River. And, you know, I know that childcare is important in my downtown Toronto riding, the constituency I have the privilege of representing today. But I also know it really matters to families in Regina. And I know it matters in the small farming communities that are the heart of Canada's amazing prairies. People don't always appreciate that. I did a town hall just before COVID started in Peace River. I wanted to hear from the farmers there what they needed. And one of the things that one of the farmers at that round table said, a young mother and agronomist who farms with her husband, she immigrated to Canada from Sweden. And she said, you know, it's a real problem. It's really hard to get early learning and childcare up here in the Peace Country. And we can't have the kids running around underneath the tractors and the combines. And I'm a part of running this farm, and it's really hard. And so it really matters to me, Dustin, that we have been able to do a deal here in Saskatchewan for families who live in Regina and also for families who live in small rural communities across this amazing province. So thank you very much. Saskatchewan today, beautiful Saskatchewan with your beautiful, beautiful skies that I take such pleasure in seeing. You are now the 8th jurisdiction to take this great step forward for Canadian families and Canadian children. As Ahmed pointed out, Saskatchewan is one of several provinces that are overperforming, and you are committed to reaching the $10 a day target ahead of the federal 5-year benchmark goal. So well done. And I want to say to all Canadians, with today's agreement, nearly half of Canadian children under 6, 47% to be precise, will now have access in 5 years or less to early learning and childcare for $10 a day. And nearly half of Canadian children will have fees for their childcare reduced by 50% by the end of next year. So we're really making progress across Canada. We're making progress in the prairies. We're making progress on the Pacific coast. We're making progress on the Atlantic coast. We're making progress in the north. We're making progress in the south. And I am so, so delighted that thanks to the hard work of people in this room, Saskatchewan families, and most importantly, the great Saskatchewan children are going to be able to share in that. It is so amazing to me what we can do when we work together to improve the lives of Canadians and of Canadian children. I've already thanked Dustin and the Saskatchewan team for working so hard on this. I do also want to offer a shout out to my finance minister colleague, Donna. She and I have talked about this. I know how personally committed as a finance minister, but like me, also as a mother of 3, she is to early learning and childcare. And so Donna can't be with us here today, but I know she's with us in spirit, and I want to thank her for the hard work she did to get this done. So thank you again, everyone, for the hard work you did to get us here. This is really a historic announcement for Saskatchewan. It's a historic announcement for Canada. This is an important milestone on the way to Canada's economic recovery from COVID, to Canada coming roaring back. Thank you very much. Merci beaucoup.
Thank you so much, ministers. Investing in quality early learning and affordable childcare will benefit Saskatchewan families and their children. You mentioned a hat trick. Well, I get the distinct honor now to introduce my good friend and probably one of the best hockey players Halbright, Saskatchewan has ever seen. Here to speak on behalf of the government of Saskatchewan is the Honourable Dustin Duncan, Minister of Education. Minister Duncan has been the MLA for Weyburn Big Muddy since 2006, currently serves as Minister of Education, and has previously served in a variety of roles, including as Minister of Environment, Minister responsible for SaskPower, Minister of Energy and Resources, and the Minister of Health. I now invite my good friend, Minister Duncan, to say a few words.
Well, thanks very much, Derek, and good morning, everyone. Thank you for joining us here today. I have to just say that as a father of 3, ages 7, 4, and 2, this reminds me a lot of what it was like working from home during the height of the pandemic, trying to keep one ear on what the ministers were saying and also with one other ear hearing the joyful sounds of children playing not far away. I want to thank Deputy Prime Minister Freeland and Minister Hussen for joining us here today in Regina to make this important announcement for Saskatchewan families. I also want to acknowledge my colleagues, Minister Laura Ross, whose constituency we are in this morning, Minister Christine Tell, Minister Jean Makowski, and MLAs Mohammed Fayez, Mark Doherty, and Gary Greywall, as well as our MC MLA Derek Myers. I also want to acknowledge my Deputy Minister, Donna Johnson, and our incredible team, Jerry, Trish, Robin, and everybody else who has worked so hard to get us to this place that we are at today. I also want to take a moment to thank our hosts, our wonderful hosts at the amazing organization Hope's Home, for welcoming us to your beautiful center. As I mentioned to the ministers when we met beforehand, this is just one of the many joint use school projects that were built in the last couple of years here in Saskatchewan, each built with 90 space childcare centers right in the schools. 18 joint use schools in 9 locations, each with 90 space childcare center as a part of the largest school construction project in Saskatchewan's history. It's so great to be able to gather in person and to have these wonderful children here with us today. They and their families are ultimately why we are here today. I'm also thrilled to be joined by Board Chair Angie Stevenson and Executive Director Georgia Lavalley from the Saskatchewan Early Childhood Association, as today's announcement impacts all of our amazing childcare providers around the province. Today is a great day for working families across Saskatchewan who depend on childcare. That is why I'm pleased to be here to officially sign this agreement with the federal government, solidifying the commitment to ensure that parents of children newborn to age 5 will have access to affordable, quality, and inclusive childcare. We thank the federal government, Minister Freeland, Minister Hussein, for their commitment of $1.1 billion to reduce out-of-pocket childcare fees for parents and to make life affordable, more affordable for families. With this investment, our province will be reducing parent fees for regulated care by an average of 50% by the end of 2022 and to an average of $10 per day as a part of this 5-year agreement. We also commit to creating 28,000 new regulated childcare spaces. This is in addition to the more than 7,000 childcare spaces that we've created since 2007. We will also be working with stakeholders, including First Nations and Métis representatives, people experiencing disabilities, newcomers, and official language minority communities to develop childcare options that are inclusive of culture, language, and identity. Helping Saskatchewan families meet their childcare needs by providing quality and affordable childcare is one of the best investments that we can make in our youngest learners and our economy, especially as we recover from the pandemic. We recognize that in order to have a childcare system that meets the needs of families, the wages of early childhood educators need to reflect the hard work that they do. I also want to thank the federal government for their commitment to invest more than $17 million to fund an increase in operational funding for licensed childcare providers that will increase staff compensation in 2021-22 up to $3 per hour. This one-time investment will fund the wage increases and training options for early childhood educators to increase support, build a qualified workforce, and get more people to enter the profession. Along with these significant investments, I'm pleased that we will also extend the existing Canada-Saskatchewan Early Learning and Childcare Agreement and invest more than $13 million to continue support for the early learning and childcare sector through a variety of programs and initiatives. Both agreements take into consideration the unique needs of Saskatchewan families and children and provide them with the flexibility and choice in childcare, as well as the needs of the childcare sector.
Ample evidence of different measures that different levels of government regulate to ensure this protection of the safety of Canadians. And this is another example of how the government has a role, and it also demonstrates how much of a difference it makes, the policies that government make to improving the lives of Canadians. So we fundamentally disagree. Canadians expect this from their government, and we think it is the responsible and the prudent thing to protect the health and safety of all Canadians.
Transparency is what we really need to help guide us out of this pandemic. Vaccines are a great tool. Don't get me wrong. I believe that vaccines are a great tool, as well as I believe that contact tracing and making sure we know where disease is coming from so that we can track where it is going to. But I think that as the general populace, that we need to voice an outcry for transparency, that making sure that government is actually sharing the data, sharing what is actually going on, and stop hiding what is happening behind the scenes and hiding the special interest groups that are run by large corporations, and stop trying to feed the greed of the machine instead of helping and servicing the people. So, as you here in Canada may have guessed, it looks like we are going to be headed for a federal election, and the best way to vote and vote for what you believe in not just a party. So I want to thank everybody again for listening to me. I'm Michael Clogs, and you've been listening to Policy and Rights here on Depictions Media Radio. For more information, websites, and things like that, please go to depictions.media and read through our blog and see what is actually happening in our world. Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help. How we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.